a test and treat strategy within the U.S. criminal justice system.
Thank you. So basically, I'm going to present these results on behalf of the STAR Core Modeling Group. It's a modeling group that they take care of different prisons or jails across the U.S. So later on, I'm going to show you which one of those people. So the objective here is to develop a deterministic mathematical model using a multiple source of infection. Basically, we have infections among heterosexual individuals, we have MSM, we have injection drug users. And so we want to assess right now the potential effect of expansion of testing, HART, and engagement into care on HIV incidence, HIV/AIDS mortality, and HIV prevalence. And the time horizon is going to be from 5 to 10 years, because lots of things can change if we go a little bit further. And the target population right now is going to be all individuals currently living or entering the U.S. correctional system. So we will obtain, I am obtaining data on like clinical behavior and epidemiological data. And Connecticut is going to give me data for injection drug users. Rhode Island has a little bit of a mixture of epidemics, has a little bit of everything. Georgia and North Carolina, they're going to give me data of the HIV epidemic among MSM and heterosexuals. And I should say that right now, the Georgia data is from Fulton County. I had to practice that a lot. And the collection is almost complete. And the other states, they are underway, like the data collection. And this is the model. So you have to bear in mind that right now, individuals are going from community to jail to prison, and then from prison, they're going back to the community, and then it's like a circle, you know what I mean? So, and within those movements, you are negative, you become positive or known, then you're positive or known because you were tested, and eventually you're gonna be on HART. And do I have? Yeah. So here is the first insert, and that means that if I'm positive or known or positive known, I'm gonna go from acute phase to chronic and late stage. And basically I'm gonna rename eventually this late stage to I'm gonna be there until I become eligible to receive treatment. But for the time being, let's stay with late stage. And in the documentation I have for this model, every single parameter and box is explained. And if I'm on HART, then basically it's like a random process. I might start HART with a very high viral load, and depending on my adherence, resistance, and a whole bunch of things, I will, like in the next step of this model, I can be any of these stages. And I should mention that it's possible for individuals to leave this system because they died, or because they drop off treatment, or because they got lost in the healthcare system. So we have also accounted for that. So because there are lots of data, and then the dynamics among MSM is different from heterosexuals and IDUs, so baby steps, I start with the MSM component. And of course, eventually I'm gonna move to females as well. So we, as I said, we are gonna focus on the epidemic in Fulton County. The risk data in Georgia, unfortunately, is missing when they report HIV in UK. Is the risk factors, you know, is not well captured, so some assumptions will have to be made. And when the risk data is reported, we see that MSM is is like the most common mode of transmission. And because of the population in Georgia, especially in the Fulton County, the people most at risk are the African American male population to acquire HIV through the MSM mode. And we're gonna be, it was really hard to define who is the population that's at risk, because it's at the risk of going to prison, to jail, and to acquire HIV. So it's like, until now we're discussing that, you know. So for the time being, I assume that it's gonna be those African American men age 15 to 54 years. And the data is coming mainly from ENS modeling, and is a some part of the data is coming from the enhanced link and the ideal studies, but I also obtain data from the US Census Bureau and the Georgia State Department of Health. So this is a completely work in progress, and I just finished compiling some of the results, and basically this is a very simple example of what I can get from this model. I tried mixing HIV testing and heart coverage. So I first just did HIV testing. So I increased from 30 to 75%. Then I did the same thing for heart coverage. And then I realized that what I can get in terms of this side is incident cases averted, and this is HIV/AIDS death case averted, was not as compelling as if I combine, of course, both interventions. So by increasing testing and heart coverage by 30%, you see that these are the number of incident cases averted among MSM, and these are the number of deaths that I avert. And of course, as I increase both testing and heart coverage, the amount of both incident and death cases averted increase as well. So right now, like based on what I've learned so far from the model, the most effective strategy has been to increase both heart uptake and testing, because again, you have to remember that this is a multifactorial problem. It's not just testing in the community, it's testing in jail and it's testing in prison as well. Fulton County is a little bit different because once you enter in prison, everybody's tested, but the same is not seen in jail. Of course, is not perfect in the community. So all those cases averted are, from these three sets combined. So later on, because the contribution of each of the sets is quite different, so that's why I'm taking time to model this, because there are lots of wheels moving at the same time. So the next stage, I'm going to introduce also, once these individuals are released from the criminal justice system, let's make like a little compartment that says, okay, the person that's HIV negative is not only going to go back to the susceptible pool, they're going to be like in some compartment that maybe I can do some risk reduction, like harm reduction initiative. I can give methadone or whatever I can do so that these individuals, they don't go back to the same risk that they would have if nothing was done. So that's another way that we can see if, that cascade of care can be applied in this setting here. So as I said, we're going to continue modeling for other settings and other risk groups. And this is the SCA core modeling group, which stands for Seek, Test, Treat, and Retain Corrections Modeling Group. And this is an NIDA-funded project. And these are all the players that we have in this project. Thank you very much.